signs of cancer women tend to ignore. Create a baseline of what is normal for you. When you take time to establish your baseline, you'll be first to recognize health changes. If you routinely check in with your body and benchmark your grade, you're more likely to notice health changes. Here are symptoms women often ignore. Number 1. Abnormal periods or pelvic pain. Abnormal periods are not uncommon. Your period can be impacted by many factors such as pregnancy, menopause, obesity, thyroid conditions, endometriosis, benign ovarian cysts, or even stress. However, when you begin to have sudden significant changes in your cycle, it's time to see a doctor. Changes such as having significantly heavier periods month after month should be looked into. Pelvic pain and irregular bleeding can be a sign of cervical, ovarian, or other gynecological cancers. Number 2. Bloating. Bloating, or consistently feeling constipated, can be a sign of ovarian or uterine cancer. If you're popping a gas X every day, it's time to see a doctor. Number 3. Blood in the stool. Seeing blood in your stool can be scary. However, many people are quick to blame hemorrhoids or constipation. While hemorrhoids are extremely common, roughly 75% of the population will get them at some point in their lives. Blood in the stool should never be dismissed without seeking medical attention. Blood in a bowel movement is never normal and should always be checked out. Blood in the stool could signal serious problems such as colon cancer, which is becoming increasingly common in people under the age of 50. Number 4. Breast dimpling, discoloration, or other changes. Women are very aware that lumps and bumps in the breast can be a sign of breast cancer. However, breast dimpling is a lesser known symptom that should be taken seriously. Other breast cancer symptoms include swelling, tenderness, skin discoloration, and even nipple inversion. It's important to remember that if you have these symptoms, it does not mean you definitely have cancer. However, it's important not to overlook these symptoms just because they do not seem important. It's always better to be safe than sorry when it comes to your health. Number 5. Chronic coughing. Is it the common cold, allergies, the flu, or something more? Everyone gets sick from time to time. But if you develop a cough that lasts 2 weeks or more and do not have any other typical cold symptoms, it might be a sign of lung cancer or leukemia. Coughing up blood is also a red flag that something needs immediate attention.